with the title of the presentation, Aesthetic Concerns with No Preparation Veneers.
مساء الخير.
مساء النور.
كيفك دكتورة؟ شو أخباركم؟
أهلا بك، تفضل.
مساء الخير، كيف الجميع؟ تمام؟ هذه أنا حكي عربي وإنجليزي ميكس. This is my fourth time in Egypt at the EDZIC. كل مرة. حظي كويس الحمد لله. الله يخليك، تسلمي دكتورة. شايفين العنوان اللي هو Aesthetic Concerns with No Prep Veneers. مين بتشتغلوا veneers؟ يرفع ايده اللي بيشتغل veneers. No prep ولا prep؟ prep. معنا حناخد mix of things. حنحكي إن شاء الله على no prep و some prep. Because of the time limitations, we only have 30 minutes. So I'm going to go quickly. If you have any questions, inshallah, we'll do it at the end of the session. Factors affecting your decision to do a veneer or not to start with. And if you want to do a veneers, do you have to do it no prep or do you have to prepare? This is the question. So what I put here is just some of it from the experience, some of it from lectures and articles, but I want to make it simple to you. We need to decide if we have to treat this patient with veneers to start with, and if we want to do veneer preparations or not. First of all, we need to see the relationship of the incisal edges to the lower lip. The second thing, we need to look at the lab work, sandblasting the teeth, existing restorations, patient expectations, alignment of teeth. So I'm going to talk about some of these items, really in short words. Relationship of the incisal edges to the lower lip. We need to rely on certain things. We need to rely on photos, videos, and mock-ups. I'm sure you do a lot of mock-ups just to show the patients how their teeth will look or how their smiles will look at the end. Let's take a look at the photos. We need to evaluate the relationship of the incisal edges of the upper teeth to the lower lip. How can we do that? We have to take certain pictures, certain photos, with certain angles. I call it the 3, 12, 9 o'clock angles. If we want to talk about first, the 12 o'clock angle, which is from the top, and this is according to the dental chair. You want to sit according to the dental chair on a 12 o'clock to the patient. And this picture from a 12 o'clock, 3 o'clock, and 9 o'clock. This is the best photo to evaluate the relationship of the incisal edges to the lower lip, which is called the smile line. We need to see a certain area, which we call the vermilion border, right? So let's make it simple with some cases. Tell me about this patient. We're doing veneers for those patients, right? So for this first case, should we prepare her teeth or not? No. Definitely not. She has reversed lip. Even the wet part of it is showing. So we need to push her teeth outward. We want to protrude her teeth. So this is a no prep case just from this picture. Of course, there are other factors, but we need to make a decision just from this picture at this point. What about this patient? What do you think? Should we prepare her teeth or not? Just from this picture. Of course, we have to take videos, mock-ups, but from this picture. Maybe yes, maybe no. Okay? What about this one? This is definitely a prep case. Otherwise, she's going to have horse teeth. No prep, no to minimal prep, traditional to aggressive prep for a case like this. The top case, do we have to prepare her teeth or not? Yes, maybe a little bit. What about the bottom tooth, the bottom teeth? They are retruded, so we need to push them out. So making decision to prep or not to prep is not just from a picture, but pictures will help. Always make your decisions before, when you first have the patient, take pictures, take videos, whatever you want to do, put it in your computer, analyze the case, and then make a decision. This is before and after. But a case like this, she has really bad teeth. The end result looks fine. How do we decide? We did the mock-up first, and this is with the mock-up. So I'm looking at the vermilion border, right? So should we prepare her teeth or not? This is with the mock-up on. We should, because she had a lot of fillings, a lot of stains in her teeth. So we need to replace that. But the same patient came back 2 years after we finished the treatment. This is the same patient. What did she do? Fillers. So always ask your patient if she or he is planning to do fillers. Always make your decisions and treatment analysis before they do any kind of fillers and Botox. Why is that? Because your treatment is more permanent than the fillers and Botox. I don't know why they look at that as nice lips. I don't know. You agree with me? Let's take a look at the mock-up. A mock-up, it's a trial, it's a prova. We need to see how teeth will look, or how the smile will look. So I'm going to go with you with this case. This is one of the patients. His name is Bisher. Gummy smile. We did crown lengthening. Now, what's next? This is 4 months after crown lengthening. So the soft tissue maturated. We have no bleeding. Everything looks fine. Should we prepare his teeth or not from this picture? Let's take a look at more pictures, maybe videos. So at this case, he's a big guy, but he has small teeth. Mostly, it's a no prep, but is it 100% no prep? Let's make a decision according to the mock-up. We need to take impressions. From the impressions, we need to do wax up and then do an index. What can we use for such a case? We need to use temporary crown or bridge material, and it comes in with different materials. It could be acrylic, like what we used to do at school a long time ago. It could be bis-acrylic material. It could come 1-to-1 ratio or 1-to-10 ratio, or they could be auto-mix syringes nowadays. So let's talk about Bisher and do his mock-up. Applying the material on the index, on the buccal and the incisal. We did not do any preparation yet. We're just placing the mock-up over the tooth, over his teeth. We do it in scalloping because we need to clean really well. We need to maximize the aesthetics with the mock-up, with the acrylic, to achieve the result that the patient can see. 5 minutes later, just remove the index and remove any extra acrylic around the gums. Teeth size is according to the golden proportions. We want the centrals to be the most prominent teeth showing. Now this is just the mock-up, and we need to take and analyze this case. It's just immediately. The patient needs to see this. Take pictures, take videos, and then go from there. So this is before, and this is with the mock-up. I want to take some pictures from 2 different angles. We talked about 12 o'clock. Which angles are these? This one on the left side. This is a 9 o'clock, and this is? That one has an angle to it. It's an 8 o'clock, or it could be 4 o'clock. But the most accurate one is the 9 o'clock, 3 o'clock. So I need to see the vermilion border, right? And accordingly, this is what we see. It's the relationship between the dry and the wet lip. Same thing. That's an 8 o'clock, and this is a 9 o'clock. The patient is happy. He wants to proceed with it. Should we prepare his teeth or not? We did not do the treatment yet. This is all trial. Should we prepare? Big smile. Should we prepare? Should we prepare? No. Zero prep, almost. Okay? We want to thicken his teeth. We want to make them more protruded. We want to elongate his teeth, close the gaps, close all the diastemas. Quiz, this is 9 o'clock. What about this one? شو رأيكم؟ لا 2 o'clock لا you come from behind. This is more of 4 o'clock. طيب في questions كتير جاي. Wait. هلا this is the patient. At this point we did his veneers, no prep. The only thing you want to do in his case just to do some roundation on the incisal angles. You don't want to have any sharp edges because this is a weakening spot and it could cause cracks in the future. Finishing his case at time of cementation. So, no prep. This is wax up mock-up, and this is the final. Now I want to show you before mock-up and final. If you want to look at these two pictures, the mock-up and the final, are they the same? Which one is more pleasing? Why? Exactly. We went to each tooth. Now when you take pictures and analyze them when you have time, اشرب قهوة شاي في البيت, analyze the case, there's a problem with the mock-up. Although I did not see it the first time we did it, but there's a problem with one of the teeth is taking over the golden proportions. So we need to go for golden proportions. Let's take a look at this this canine. Compare which one is more smooth. The mock-up one looks a little bit wide. So what we want to see is to make sure that we have only the mesial part of the canine showing and the distal part hidden. We don't want to have that showing. And this is what we did with the permanent. This is the relation. The patient does not care much about it, but this is the communication between me and my lab. I want to tell the lab technician, even with crowns, please do an angle, do like a bevel on the distal part of the canine for it not to show and to hide that width. We don't want that width to show as much. What about this lateral on the left side? Let's make it bigger here. It looks a little bit wide compared to the central. With golden proportions, the lateral should be, or the central should be 1.6 of the lateral. Okay, like مرة ونص تقريبا. In this case, no, it's more. So it's the same tooth, but we need to bevel it. We need to play with the anatomy of the ceramic itself for the light reflection not to be too much. We need to distract the light when the patient smiles. What about the centrals? Which one more pleasing? The permanent one. So we made analysis. All mistakes could be done with the mock-up, and then you'll have final result that the patient will like. You won't have much chances that the patient will give you a hard time. And this is after we finish. We make sure that it's 12 o'clock position when they smile. So, always, do you know this application? It works only, as far as I know, from iPhone 10 Plus. Does not work with Samsung or Huawei. إلا إذا جربتوه ما بعرف. مين معه iPhone 10 Plus؟ نزلوا هذا الapplication. This is a very nice application where I give my phone to my patients after finishing, and they do this. This is the same patient. They can scan their face 3D. هذا في الابل ستور. It's free. And you can have your patient play with his face in a 3D motion. Look at this. After collecting all data, the software itself within a few seconds is going to collect the 3D image for this patient, and he can play with it. It's just keep him busy. Keep your patient busy. Just a software. Nice one. He got married after that. So خلاص خلصنا له الأمور. Now let's talk about alignment of teeth. This case, what do you think? Occlusal view, frontal view, lateral views. Do you see any problems? The patient sitting on the chair, she wants veneers. And she is a dental student, by the way. So what options would you give this patient? Ortho, definitely. Why is that? Crowded teeth on the centrals, pig-shaped laterals, right, on the upper teeth, and some crowded on the lower. So the option, she does not want braces. So what options should I give the patient? Invisible aligners. Okay, you need to make decisions with the patient. Otherwise, she's going to end up having crowns in the front, unfortunately, if we don't correct her bite and the alignment of her teeth. So, Invisalign was done. Crowded teeth, the crowdedness is eliminated. And we asked also the orthodontist, this is a communication between you and your orthodontist. Because with Invisalign, you can request things, right? It's all online. And we need to have a certain space, mesial distal, between the laterals, centrals, and the canines for me to what? My plan is to try to place no prep veneer as much as possible. So what should I ask the the orthodontist to do? Is to align teeth as much as possible, to open spaces between the mesials of the laterals and the distals in a certain amount for me to be able to go and recreate the golden proportions, because we want to enlarge the laterals, right? The centrals are beautiful. This is after Invisalign. Everything is aligned. But the question to you, should we prep or not? We're talking about only laterals. Don't go for 10 veneers or 8 veneers. It's so aggressive treatment. It's non-ethical. Just bleaching if the patient wants. Wait for a month after whitening or bleaching for the color to stabilize, and then go and do your treatment. So my question to you from this picture, can you tell if you will be able to do it with no prep or prep? From this picture, can we make a decision? This is your question. Let's always look at occlusal views. Always look at occlusal views. From this picture, when you look at the right, this is reverse, but let's talk about, this is the right one, okay, and this is the left one. Should we prepare this tooth or not? Let's put a line and see how much space we have buccally. From this picture, should we prepare or not? We have enough space. We have more than 0.5 millimeter. Minimal, if there's any. But for nowadays, if it's an Emax or feldspathic, you can do it with 0.3, 0.4 millimeters. We're okay. What about the left side? So my right side will be okay. I'm going to be placing a veneer. Okay, but it should be wrapping around because to close the gaps, mesial and distally. The left side, if we look at the left side, the tooth is still fist-weight rotation. Okay, so my concern is this spot. Okay, so this is my concern here. So what should we do at this point? What I want, we need to adjust and eliminate this red spot. So this one is a no prep. What about that one? What do we call that? Is it minimal? Minimal, I would say you still have to cut more. We call it something else. Selective prep. It's just one spot on that tooth. And this is how it should be. We should not prepare teeth all the time. We should be more conservative. We don't have to cut the whole buccal surface. We can just adjust one spot of it. So this is before, and just by placing 2 feldspathic veneers on the laterals, and make sure that you have excellent occlusion, otherwise they're going to break. So please, on protrusive movements, always check your veneers. When you decide to do no prep veneers, we have a prismatic layer, right, on the enamel. We can etch and bond and do all that, but to make it last longer, sandblasting the buccal surface before etching and bonding will give us more freedom to get more retention. We use sandblaster by using 30 to 50 microns aluminum oxide on the buccal surface. This will give you more rough surface to bond to. And this is, you can use this intraorally in the patient's mouth and attach it to your high speed without water. So when the patient comes in for the cementation protocol, you want to apply that 90 degrees for 15 seconds just to scratch the enamel and to expose it more for etching to get better bonding and adhesion. One of the things is the lab. Your friend, اللاب technician لازم يكون صاحبك. صح؟ So, in a case like this, this is after placing the veneers, but can you tell that the patient has protrusion already? Because she has really protruded teeth. So unfortunately, with cases like this, you have to have heavy preparations. And they could be almost like 3/4 crowns. But you want to rely also on your lab technician artistic work. If we take a look at this, we all know that we have to do 3 planes of reduction: incisal, middle, and cervical. A combination of the 3 of them will give you convex surface, right? And the tooth is convex. If you have a patient with protrusion, if you're not doing any preparations for any reason, you don't want their teeth to show protrusion. So exactly, you need to have it all pushed back, like this picture here. Make sure that you have your lab technician play with the porcelain in a way not to have a really heavy convex. You want to have a little bit more straight here just to push her teeth a little bit inward. And this is just for the lab technician to work with. It's all under your recommendations. What if you can't tell to prep or not to prep? If you have a difficult case, if you have a dentist patient, this is tough. So what you want to do is to use the mock-up itself as a guide and prepare over it. Like this case. Let's take a look at this patient. She has long teeth, spacing, picture lateral here, rotations. It's tough to know. So we'll be doing a wax up for 6 teeth at this point, and then a mock-up after the wax up. With the wax up here, we need to align her teeth as much as possible. Do the same thing like what we did for the other patient. The mock-up itself, but this time I'm not going to remove the mock-up. We want to keep the mock-up in the patient's mouth and start using the burrs, the reduction burrs, the depth cutting burrs intraorally while the mock-up is in the patient's mouth. So this is the mock-up itself. Now we'll go with the wheels or with the round burrs, whatever you are using for depth cuts to go and prepare over the teeth or over the acrylic itself. So this is the acrylic, you're going over it and push hard. You have a safety neck on these bears, so don't worry about them. You're going to create some depth cuts here. Some of the areas were touched, some other areas are not. Still very, this is called selective preparation, and some of them are minimal preparation. This is after all preparations, but we have a problem with this patient. We have a gap in one area, and we have nice contact with other ones. So the treatment is different. With this way, you want to go somewhat midway contact, midway preparation. On the other side, where you have a space, the lab technician will wrap the ceramic itself around and will give you nice contour. With this side, we can do it in 0.2 to 0.5, but they're very weak because they're feldspathic, so be careful. ديروا بالكم, they could crack. So after cementation, you'll be okay. Just check your occlusion. And preparation designs, you can, there's no time to discuss preparation designs, but we have no wrapping or the window design, the partial wrapping, and the wrapping with chamfer. At time of cementation, you want to place all your veneers, make sure you have good curing for all of them, clean all the margins, polish the ceramic after bonding. And how many veneers did we do here? You tell me. Total. We did the wax up on 6 teeth. But do you remember the smile? We had a problem with one of the premolars that was pushed in. So we added another veneer just to have a nice alignment of teeth. So 7. We don't have to do, double digits. Okay, so this is before, after. So this is selective preparation on the same tooth. 3 years later, we're talking about follow-up. The patient came back for follow-up. Make sure that you have good occlusion, good hygiene, and protrusive movement all the time. Make sure you don't have any premature contacts for them to stay very long time. Conclusion. What I want to discuss with you, or what we discussed already, that aesthetic limitation with no prep veneers, it's not for everybody. You can have protrusion problems. You can have very thin veneers that are weak if you have to place them, and translucencies. Once you have less thickness, you'll have the lab technician cannot play with the ceramic as much. The second thing, no preparation is not for everybody, and combination of preparations like other cases, you can do same patient, you can do traditional preparation for one tooth, selective preparation on the other one, and no prep on the third one. Advertising, no pain. Do you remember these advertisements? The first people who did that, no pain, no shots, no prep, lumineers, right? Definitely. You have sometimes, they changed. Now they're telling you minimal preparation too. So my recommendation is to believe that a veneer is a veneer. It could be no prep, it could be prep, it could be selective prep, but no prep. If you want to really do it right, maybe you have to do orthodontic treatment first, maybe some other treatments to align teeth in a way that you can have no prep veneers. I want to thank you for your time. If you have any question, I'm here.
Thank you, Dr. Hakam. أنا يعني فعلا I enjoy your lectures. I really enjoy it.
Thank you. Thank you.
Any questions? وفيت والله ما قصرت.
فهمتوا علي ولا ما فهمتوا؟ كله تمام؟ اتفضل.
دكتور بعد اذنك لو السنه لو مثلا في سنه فيها بروتروجن وفي نفس الوقت عليها شويه ستينز البيشنت محتاج فينير، لو ما كان الصح ان انا دكتور تريتمنت او مرجعهم مش هيقدر كده احط الفينير؟
Yes. الدكتور بيسأل إذا في عندي protrusion and stains. Alignment with ortho is the best. Always do orthodontic treatment is a patient if he wants to do it. If not braces, maybe Invisalign will help. So always align teeth and then place the veneers. They will have nice protrusion, nice profile when they smile. Yes.
What about the retention?
The retention is perfect. You are using, you're staying almost on enamel. So when you're enamel, you can do etching and bonding with nowadays adhesives, new generations, with MDP monomers, and you can adhere to anything. It's excellent. The only problem is occlusion. I insist on occlusion. Be careful with occlusion.
Self-etch or total etch?
Total etch or self-etch? Total etch. You have to etch enamel. You have to etch enamel. Yeah.
أنا دخلت كم كورس فينيرز فكاتكم يعني الدكتور قال إنه النو بريب فينيرز المشكلة مالتها إنه إحنا ما نقدر نسوي ادهيجن على سموث
سيرفيس. صحيح.
الاعتراف الثاني اللي كان إنه الثيكنس مالتها حتى إذا كان مينيمال ثيكنس راح يأثر على
اللوك.
على اللوك. فأنا في هذه حالتين حلت أنتم يعني هنا بالكلام مالتك يعني أكو فاريبل يعني
طبعا بالادهيجن على سموث سيرفيس ساند بلاستنج. انت كنت موجود ساند بلاستنج. يس ساند بلاستنج. It is effective. It will make you really nice and rough surface as you want microscopically. But you have to use aluminum oxide particles 30 to 50 microns, certain microns, to get you nice retention.
السؤال الثاني الترانسلوسنت سايز هاي ما نقدر نسويها بالكاسكام صح؟
It's hard. يعني I still believe بالveneers to do it manual. Artistic work. They have to build it up, especially feldspathic. I don't like Emax as much, unless if you have thick Emax, where you can do the core and then build up porcelain over it. مش Impress, no, Impress Emax. I'm talking about feldspathic, an old-fashioned way, powder liquid. It's more translucent. It's not as strong, but it will give you nicer and more aesthetics.
The only way to get to the translucent incisal.
No, you can play it. You can do it with Emax too, but you have to build the incisal edge with ceramic, with feldspathic powder and liquid.